up, we have Q&A. So looks like there's one.
Yep,
Okay,
I have
great.
it here for you. Does a plan need to have a member portal in order to use some of the services Clarity has been sharing in this webinar? Um,
Absolutely not.
it says
No,
my
yeah,
plan, Hennepin Health, doesn't currently have a member portal, but we're planning to write an RFP for one.
yeah. No, no, you don't have to have a portal really at all for this. And looking at a lot of plans do. It's great that you're going out to RFP for one, but really, honestly, what we have seen is that portal adoption it's a challenge and it is fairly low in healthcare and for health plans, right? Because there's just the challenge of getting somebody to, and you know that anytime you got to go somewhere and you got to log in, you got to remember your password and get into it, and then how many clicks away is it to get the information that you need? I mean, if you can simplify it, like we will can send like some, like for example, your EOB's ready, and if someone has opted in and you've captured a preference, which you don't have to have capture that preference through your portal, we have a preference portal that we can use that like QR code. So on a EOB, somebody has gone in for a service for, like I said, for like the MRI on their hip, right? You can scan, we can put a QR code there. That QR code can be scanned and it can take them directly to whether it's a MSK program, or you could have them scan it, sign up for, sign up for digital, provide us your preferences. We
Okay,
can do that on our side with the portal.
there.
So
Our next question.
mhm.
Members say they want more digital experiences, yet adoption has been chronically low year after year. Why do you think this is the case, and what can health plans do about it?
Well, I think you've got to have an easy way to be able to capture that preference. Right? If you don't have it and you aren't capturing it right up front. So when somebody first joins a health plan as a new member, it's an ideal opportunity to be able to ask them right away in that initial communication. So when you send their welcome letter that includes their ID card, right, use that QR code individually for them to say, you know, you need to try to move them to the portal to get them to go to the portal, but really you can stop right there and you can say, how do you want to be communicated with, right? Your preferences are important to us and we want to make sure you're communicated in the way that you want to be. So let us know and provide your email. Well, take that opportunity at the right points with those core communications to and gather the information around preferences. And so you should have that capability, whether it's on your portal or a vendor who is capturing the preferences for you, and then use them. Use them and use them consistently across the board. Right. So if you have captured that for an individual, a health plan has an email address, like that should be a preference. We capture that, we provide it back to you so that you have it and use that permission then to continually communicate with them. Okay, we've got another one. How does Clarity cost compare to member portal cost? Well, it's apples to oranges there, really. If you think about what Clarity does, the ID cards, totally separate than the member portal. The EOBs that we do, any of the communications we send out, it's not the member portal. We don't offer a member portal uh, as far as a product. We can connect to your portal. We have web services and we connect into web portals like all the time. We connect web services into customer service to see who was sent what when. But we don't do a portal. We do member portal. We do a preference portal, which is really a stopping off period in between directing them like to your portal where we can gather and and gather information around their preferences. So really not we don't have a member portal cost. Great
Yeah,
question. So really appreciate them.
our next question. Uh, Digital is the focus for healthcare based on all the things you've outlined. But what does that mean for print as a way of
Yeah.
communication? And how do you view print outreach?
Yeah. Well, this has been question that we've been kind of dealing with, I think, for my entire career in healthcare of like, when's print going away? Really? I mean, there's that question's been, and I can tell you that while there is more and more digital communications and you need to be able to support them, print is not going away anytime soon. It's not. I mean, it's required for some compliance communications where you have to send it out, and if you don't have that email and those preferences, you know you've got to send it out via print. So, and then there are people that want print, and while some of them are in Medicare Advantage and the older, it's not just that population that we're seeing. It is we had a survey done for some of the um, younger and the younger generations, and like people had said that they really liked being able to have print, that they felt that it was print was like something that was really important and really tangible to have in their hands. So it's not going to go away. Someday, I don't know when that someday is. I don't think it's going to be during my career, that's for sure, or maybe not Annie's either. But but you need to be able to address it, and you need to be able to do both, and you need to be able to combine those communications between print and reinforce with digital and email. So, and we have our own print facility. So I mean, we are obviously very invested in print, but we also do a significant number of web service calls and integrations in email and texts as well, because you've got to be able to do the combination. But having your own print facility helps to be able to. I'm sure all of you who've dealt with a print facility, you know that there's just challenges in being able to get what you need, how you need it. So it's also our platform flexibility of managing all of the different print templates and logos and all of the different content, right? And enabling it through print, but also having it available through web services and or email and text.
Okay, our next question. What are some member acquisition tactics for health plans when people are shopping for coverage? It seems like once they are enrolled, experience seems key for once they're enrolled, but what about getting them to enroll in the first place?
Yeah, yeah. I think I would might turn that question just a little bit and say, um, like, keep them. Number one, like, retain them so that you don't have that acquisition cost of, like, trying to convince them to join the plan. Do everything you can to retain them and to keep them and to build that personalized experience. I think from just a straight acquisition perspective, um, it's I mean, really, it's kind of all over the place because I mean, I'm sure all of you have seen during open enrollment time, especially for Medicare. I mean, there's so many commercials and billboards and they're all around Medicare Advantage, and we think that it's clear to people what Medicare Advantage is and the different options that they have, and it absolutely is not. I say go out and talk to the individuals, talk to the seniors, and ask them. You know, do some testing out there of like, do they really understand it? I've done it multiple times where I've put Medicare Advantage information in front of, my mom or my father-in-law, and they don't understand. They don't understand that Medicare Advantage is even an option, much less which plan to select from. They don't understand what it is, difference from straight Medicare. So I think take a step back, ask the individuals in the markets and listen to them and try to make it as simple as possible so that they truly understand what you're trying to tell them.